How does immunohistochemistry diagnose rare bone tumors? Imagine trying to solve a complex puzzle where many pieces look similar but have different meanings. That's what diagnosing rare bone tumors can feel like. Doctors need precise tools to tell these tumors apart, and one of the most important is immunohistochemistry. This technique uses special antibodies to detect specific proteins in tissue samples. These proteins, called antigens, act like molecular fingerprints, helping pathologists identify what kind of cells make up the tumor. When a patient has a suspected bone tumor, the process starts with clinical exams and imaging scans. If a biopsy is taken, the tissue is examined under a microscope. Sometimes, the tumor's appearance alone can be enough to make a diagnosis. But rare or unusual tumors often look very similar to other types, making additional testing necessary. That's where immunohistochemistry comes in. It helps reveal which proteins are present or absent in the tumor cells, giving clues about their origin and nature. One key role of immunohistochemistry in diagnosing rare bone tumors is distinguishing primary bone tumors from tumors that have spread from other parts of the body. For example, cancers from the lung or breast can metastasize to bone and mimic primary bone cancers. By using antibodies that target proteins specific to certain tissues, pathologists can determine whether a tumor started in the bone or elsewhere. Another important application is identifying small round blue cell tumors, which include rare types like Ewing sarcoma. These tumors have similar-looking cells under the microscope, but their protein profiles differ. Using panels of multiple antibodies, pathologists can confirm the tumor's lineage, improving diagnostic accuracy and guiding treatment decisions. Immunohistochemistry can also indirectly detect genetic changes common in rare bone tumors. Many of these tumors have characteristic gene fusions or mutations that lead to the production of specific proteins. While genetic testing remains the gold standard for confirming these alterations, IHC can serve as a practical and quicker surrogate. For instance, antibodies that recognize fusion proteins or mutated histones can suggest the presence of these genetic events. Classifying tumors based on their cell type and differentiation is another crucial role. Some tumors resemble bone-forming cells, cartilage cells, or blood vessel cells. Using targeted antibodies, pathologists can identify these features and classify the tumor according to the World Health Organization guidelines. This classification is essential because it influences treatment options and prognosis. Sometimes, the histological features of rare bone tumors overlap, making diagnosis tricky. Immunohistochemistry provides objective evidence to support or rule out certain diagnoses. For example, if a tumor stains positive for markers associated with cartilage, it might be a chondrosarcoma, whereas negative staining could suggest a different tumor type. In practice, pathologists select a panel of antibodies based on the tumor's appearance, clinical history, and imaging findings. Usually, at least two positive and two negative markers are used to increase confidence in the diagnosis. Interpreting these results requires expertise because some markers are shared among different tumor types, and staining patterns can vary. It's important to remember that immunohistochemistry is often combined with other diagnostic tools, especially molecular genetic testing. This integrated approach ensures the most accurate diagnosis, which is vital for choosing the right treatment and improving patient outcomes. In the end, immunohistochemistry acts like a molecular map, guiding doctors through the complex landscape of rare bone tumors and helping them deliver personalized, effective care. Always consult healthcare professionals for individual diagnosis and treatment options, as each case is unique.